Welcome to WWDMD, a podcast that is all about peeling back the curtain on what clinicians really think and feel as they work with others. My guests, clinicians, who are also sometimes clients themselves, risk their vulnerability as they publicly share their emotional reactions to their clients, disclose their challenges in doing the work, and reveal their personal backgrounds. I'm Dr. Meyers. I'm a psychotherapist in New York City with 30 years of practice experience, specializing in anxiety and depressive disorders, as well as sibling relationships and family systems. I'm also a professor of social work at Malloy University on Long Island. I see this as a journey of self-reflection for not only our guests, but you, because with each episode, I'm hopeful that you will learn something new about yourself. Please note that any discussion of case details have been modified to protect the privacy of our clients.
What would Dr. Meyers do?
Hey everyone. I kind of believe that mindfulness is one of those words that we're hearing everywhere right now through apps, yoga studios, from wellness influencers. But in therapy, it actually means something a little different. I think that at its core, mindfulness is simply the practice of paying attention to the present moment with curiosity instead of judgment. But in clinical work, I'm getting a sense that there's a whole nother flavor and layer to it that I want to learn more about. I think in clinical work, mindfulness may be about clearing your mind or achieving some state of calm perfection, if that even exists. But it's also more than that in what little I know. And my guest today is going to help us understand what it looks like and how it's practiced. We're also going to explore what happens when clients are skeptical about it and the moments when mindfulness can really shift the course of a session. So welcome Natalie Nieves. She's a licensed professional counselor, a counselor educator in the clinical mental health counseling program at Malloy University, and a doctoral candidate at Montclair State University, where she's expected to complete her long haul, because I've been there, done it, know it, in May. So that's exciting because that
It
is
is.
literally right around the corner.
Yeah.
Wow.
Yeah.
Congratulations for all you've done so far with that. So I'm
Thank
really
you.
excited to have you here because I'm one of those people who, as I just said, mindfulness, 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 we have to practice it, but what exactly is it? It's like my students who are constantly saying that everybody always says about self-care, self-care, self-care. What is it really? Because
Right.
there's got to be more to it than going to get your nails done or taking a hot bath or whatever it
Right.
might be. So, can you start us off and just tell us what it actually means?
Absolutely. First, I just want to say thank you for inviting me on the podcast. I'm really, really excited and honestly feel like it's a privilege just to be on this and as a guest and to share a little bit of my knowledge. So
Thanks.
thank you.
Yeah, glad to have you.
Yeah, so mindfulness, right? It has become that word, that buzzword, everyone uses it, whether it's from corporate to the clinical setting. So, and this is important for us as clinicians to really understand the true nature of it, right? You touched on the definition before, but what it really is, it's a awareness of the present moment and specifically with no judgment. And so often we are thinking about the to-do list, about what happened yesterday, about your presentation, right? Like we are always thinking, and we're really never taking a moment to just come into our body and to breathe and to say, okay, I've done what I have to do for today. And tomorrow will be a new day type of thing, right? To kind of ground ourselves and center ourselves. So at its core, right, mindfulness is something, it's the essence of like traditional Buddhist teaching, Buddhist Dharma. But the reason why it's kind of come into mainstream Western culture is through Kabat-Zinn, John Kabat-Zinn. I don't know if you heard of his name, but he is the major player. Like I like to say, he's really the guy that brought it to the Western culture and really made it more palatable, right? He kind of we can say whitewashed or just palatable, whichever whichever way. But it's not right. It's not a Buddhist practice. The way in which we practice it in the Western country and in Western culture is really just like the essence of of being present and aware and non-judgmental, no non-attachment, stuff like that. So that's really what it is, definition wise. Yeah,
So, okay, that's a good starting point because already I have a million, quite not a million, but a couple questions.
yeah,
One is, I mean, there's a couple of words that stick out, right? It's like not to have judgment. I mean, that is a practice that I think is a lifelong practice, right? And I don't know if it means judgment of oneself or judgment of others, but I think about my own vocabulary or thought processes where I'm constantly thinking about what I should be feeling or should be doing,
right,
really towards looking at what I want for myself, right?
right,
So maybe there's a little bit more evolution in terms of it just being strictly judging that I'm doing something wrong. It's about how do I want to shift that into what I do want for
right.
myself. But, and then I think about judgment and I think about biases because I teach a course on diversity. And I think how I tell my students that I don't know if the goal is not to have biases because that wouldn't be human, but it's
Right.
to be aware of them, understand where they come from, manage them, and maybe strive towards shifting that perspective. So, to just hear this idea about to work towards or to be in a place where there's a judgment-free zone. Can you
Mm.
say more about that?
Yeah, yeah. And you know what? It's so true, right? We're human. At the end of the day, we're not robots. We can't just program our brain to not have judgment. Um, and I want to say what's coming up for me most as you're, talking about this is this idea that judgment has to be, or, self-criticism has to be punitive, right? We've kind of adapted this belief that, in order to really do better, to achieve, to succeed, to get to that next position, place in life, we have to be really critical. And mindfulness, what it has allowed, not just for me to understand about myself and maybe life in general, but we can accept where we are, and we can see the areas for improvement. It doesn't need to be this punitive narrative, right? We can say, okay, you know what? I'm noticing that I am really, really critical of myself right now. Okay, right? That doesn't feel good, right? Like giving ourselves that validation, really tapping into like, this isn't helpful for me in this moment. And I know this is going to be hard, and I'm going to continue, working towards this. I know that I'm trying my best, right? I know that I'm going to, hopefully succeed, or, whatever the case is, whatever you're stressed out about. Um, so yeah, right. It's not a sense of being just judgment free and like woo woo, like living on a cloud here. It's more so of like, listen, life hits us, and that's so valid. And it's okay. Like we're allowed to have those hard moments. It doesn't define or label or, yeah, categorize us as inherently bad, right?
So
It's
would you
it's a
consider it as a reflective practice? And then I think, well, now what makes this different from meditation? Because you also use the term being in the present moment,
Yeah,
right? The idea of
yeah,
that. And that's certainly what I think is the basis of meditation. I know I don't do it. I don't do it. I don't not, yeah, yeah. Anyway, I don't practice that. And I imagine how helpful that is.
yeah,
But I'm wondering, like, what's the distinguishing factor and how is mindfulness in therapy different from mindfulness as a wellness trend?
yeah, yeah. So I would say meditation is mindfulness embodied, right? Meditation is the act of just sitting with yourself, breathing, and simply, at first, really just noticing what comes up for you, right? Just, oh, I'm thinking about the laundry. Oh, I'm thinking about that shopping list I have to get done before the weekend, right? Just noticing, not placing the plan, the judgment, the to-do list, just noticing. So that's mindfulness. I mean, that's meditation, right? Kind of just sitting with your breath, sitting with your thoughts. Mindfulness is, it can encompass various different activities. So it could be like a body scan, right? It could be progressive muscle relaxation. It could simply be tapping into your senses. This is one that I, usually like to introduce to clients who are new to mindfulness. Just tapping into your senses. One thing that you can smell, see, taste, touch, and hear.
That you're choosing or that comes to you as you're cleansing your your thoughts.
So whatever, so let's say right now we could, I'm actually going to ask you, right? So if you can tell me one thing that you can see, smell, hear, taste, and feel.
But like literally,
Yes.
or I'm going
Yeah,
to
yeah.
identify something
No,
in my
like,
vision, in
oh, like
my,
physically. Yes, like physically tell me like you can see a lamp. You can, you
okay,
feel the seat underneath your butt, right? Like,
okay,
so tell me.
okay. I see my computer screen. I'm looking
Yes.
at us on the screen.
Yeah.
I feel, yes, my legs elevated on a chair under me.
Yep.
I hear, I'm supposed to
Mm-hmm.
hear, I
Yep.
hear our conversation
Yep.
and a little rattling in the background.
Mm-hmm.
I taste
Mm-hmm.
whatever I had last in my mouth, a Kit Kat.
Yeah.
And what's left? I
Yeah.
think I hit four senses.
Smell.
I smell. I smell nothing much right now.
Okay. Great.
Okay. Yes.
So that by doing that, you are not in the future, you're not in the past. You are truly analyzing what is happening right now. What do I smell right now, right? It's taking you from, out of your body into your body. So this is one skill, one mindfulness skill that's very tangible for most people and really does allow my clients to feel a sense of just grounding, a sense of control, especially those who struggle with anxiety.
I was just thinking that. I could see that. Yes. Okay.
Right,
Yes.
right.
Right. Getting away from the anxious thoughts and just,
Yes.
right, moving. Okay. Go
Right,
ahead.
right. So that would be, I would say, as an example to differentiate the two. Meditation is truly just sitting with yourself and being aware of the thoughts that are coming up non-judgmentally. And then mindfulness is more of the act, I guess, of bringing yourself to what's happening currently for yourself. That could, again, through a body scan, progressive muscle relaxation, a five senses exercise, stuff like that. So,
Well, so I know we're going to get into those because I really want to see what this looks like,
yeah,
and help people who are listening understand the different aspects that they could potentially engage in. So my first
right,
question is, do you need somebody to help you do this, to guide mindfulness for you? And then you learn to do it on your own. Like now, I would have
right,
never known, but now I could say, okay, get with five senses, right? I could do that.
right, right. I mean, yes, like you can do it on your own. YouTube is a wonderful resource, right? You can totally self-learn. Again, John Kabat-Zinn has apps. He has this one app. He has his masterclass on YouTube. He has his book, which is really where my understanding of the impact of mindfulness-based stress reduction came from. So that's actually it's a thick book, but it's a great book with a bunch of exercises, breaks down the science and biology of your nervous system and the impact of mindfulness. So yes, you can absolutely teach yourself it. But some people choose to engage in the people go to like meditation centers or they engage in yoga or other type of environments that can really bolster or even give them some accountability in a sense
Yes.
of like really trying to learn this skill because it's a skill.
Yes. And would you say that it's something that grounds you in the moment, or the more you do it, the more it stays with you and you're in kind of, and forgive me if I'm overusing the word, like in a Zen state, you're in a
Yeah.
more relaxed space just generally? Or is it a coping skill for when you're feeling dysregulated?
Right. I think it starts off that way for most people. And the more that you integrate it into your life every day, it becomes I like to say it becomes like a part of your day. It's a part of your life then,
Hmm.
right? If we engage in it intentionally every day. So yeah, I
Hmm.
would say at first it is a very tangible skill, very tangible tool. But it can, and for most people that find it helpful, it tends to really be a part of who they are and in their everyday life.
Right, it becomes a practice.
Yeah.
Yeah. So I'm very interested in the types of practice, as I said, and what kinds speak to you. But just before that, I want to
Yeah.
understand how, not how, we're going to get to the how. When
Mhm.
is it introduced and used in therapy, in your therapy practice?
Yeah. Aside from it being in my bio and, people can read that, I like to introduce it in my intake, right? Hey, this is what you can expect from me, right? I take a cognitive behavioral approach. However, I'm also really inclined to use contemplative practices like mindfulness, like meditation. And some people are like, oh, that's great. I'm really into that. And some people are like, okay, sure,
Yeah.
maybe, you know?
You got to
So
get
I
buy-in,
gotta get the
right?
buy-in.
Yeah.
So that's primarily right. That's where I like to introduce it. But then when I'm feeling the need, or not feeling the need, when I have my clinical spidey senses going off that my client is like highly dysregulated right now in session. They could be crying, they could be angry, right? They could, whatever, they could be processing just a really intense moment, right? For me, my spidey senses say, okay, their nervous system is out of whack right now, right? A big part of the therapeutic relationship is modeling, right? Modeling that safety, that stability, that calm. So what I tend to do, is say, let's after they've, processed for 30, 25, 30 minutes, right? And then they're just like, blah, tears are done and we can feel that heaviness. I like to say, I would like for us to just kind of catch our breath and take a minute to just regulate our nervous system. And some people, most of my clients, even those who aren't don't have the biggest buy-in, agree. Okay, all right. So and I will guide them. I'll say, let's take a deep breath here. Let's close our eyes or look down, right? And that tends to get a little people get a little awkward, but I model it with them in front of them. I am closing my eyes. I'm having my hands on my chest. And let's just take 3 deep breaths in and out, right? And I do that with them. I have my eyes closed, right? I'm breathing audibly for them to hear,
Mm-hmm. Mm-hmm.
right? And that right there, doing
Mm-hmm.
it in the moment when your nervous system is dysregulated
Mm-hmm.
is tends to be extremely powerful,
Mm-hmm.
right? And then we're able to become more cognitive,
Mm-hmm.
right? But if the body is dysregulated, if somatically we're dysregulated,
Mm-hmm.
cognitively, we're not in a place to really look at it in a way that in therapy, right? In a therapeutic way that we can reflect on it and maybe consider different perspectives or tools or, whatever other interventions you want to provide. So that's what it would look like in my sessions and typically how I do introduce this with clients.
Let me just tell you the analogy that just came to my mind. I was
Yeah.
thinking, like, if you're working with somebody who abuses substances, you can't really work with them. Some people believe this, that you can't really work with them if they come into the session
Hi, or using.
high on substances, right? And so I don't know if this is an appropriate analogy, but it makes me think about, almost interrupting the session, or like you said, after they get it all out, the emotional processes, and they're in the emotion, and they need to kind of get that place of calm or grounding, as you refer it, before you can continue, or maybe even end the session and feel okay about sending them back out in the world,
Right.
right? That this is that moment that kind of propels them forward or gives them that sense of safety. I
Yeah.
don't know why the analogy came up to substance abuse because it really doesn't make sense the more that I hear it. But
No.
I'm just thinking, like, if somebody is in such a state of flux or dysregulation, you can't really work with them in that moment, right? You can provide a holding environment for their
Right.
emotions,
Right.
and allow them to be and allow them to have and be non-judgmental and all of
Right.
that. But for you to then kind of continue, right, they have to kind of come down. And I guess
Right.
that's what this is insinuating. So you've given us two techniques. You've given us the five senses and you've given us breathing, right?
Yes. Yep.
Are there any other ways that you work with clients to do this practice? And how do you choose which you're going to implement?
Yeah. Great question. So I would say depending on the client, right? We get to know our clients. We get to know maybe what they would be, willing to do or what they're open to. I will say I'm kind of giving it to you in ways in which I kind of scaffold for my clients. So, right, five senses, really, really easy. And then I can see, hey, can we get comfortable just sitting with ourselves? Right? I will, suggest breathing. Following that, and let's see if it lands, right? Let's see if they are able to maybe integrate it in their time in between sessions, right? So see essentially their buy-in. How much is this really helping them? How much are they willing to engage in it outside of the therapeutic room? So with that being said, if I'm finding that, this client could be essentially into it, like I will provide, let's say, another exercise, which would be like a body scan. Right. And typically the body scan that I do in session, I mean, they vary in length, but mine are pretty short. They're maybe like 5 minutes, right? Because we only have a 45, 50 minute
Right.
billing session.
Right.
So, and I have one here. I have it on my screen just because I like to have it, just to guide me. And I mean, I can read it with you. We can kind of go through it together.
Sure. But the
Yeah.
more I'm hearing about these things, the more I'm now getting confused about how this, again, differentiates from meditation because
Hmm.
not having a real grounding in meditation or mindfulness, I was thinking about teaching a class recently and the intensity was really high. It was one
Mm.
student was processing a case that they're working on in their internship and it was deep. And you could feel the class responding, even though nobody was verbally responding. You could feel it. And I thought to myself, oh my God, I got to be prepared with some kind of meditation exercise to kind of close the class out, get them back to, baseline. And what I came across in my YouTube search were things like a body scan, things like imagining a place where you can, a beach is the typical kind of,
Hmm.
I think, pictorial used, but where you can kind of get in touch with your five senses. So I don't know if you can answer that, but now I'm getting more confused.
Yeah, no, I think for me, and I'm just one person, but I would say the distinction between the two is meditation is truly a sitting practice, right? It is truly you sit on the ground or you sit on a meditation cushion and we sit and we breathe.
Okay.
That's it,
Okay.
right? So mindfulness is meditation, right? I'm gonna say, hopefully I said this right. Meditation is mindfulness, but mindfulness doesn't always include meditation.
Okay.
Okay. So again, meditation is mindfulness. However, mindfulness can also look like a body scan. It can look like a mindful walk, right? That's something I like to give clients an activity to do. Walk outside, no headphones, just listen to the sounds, the leaves crunching, right? Try and feel your foot in your sneaker or your shoe, right? Feel the wind on your body, right? That's something a bit more active.
Okay.
Whereas meditation, again, in my understanding and the way in which I approach it, is meditation's truly a sitting, intentional breath work session almost.
Okay. But so now you're out on a walk and you're paying attention to all of the senses and and everything around you and being present in the moment, which goes back to your original definition. Where does the no judgment come in?
Mm, the no judgment comes. So that's a great, this is where the skills of meditation can be implemented with these other activities. So where does this come in? Essentially, right, we're walking, let's say I'm walking in the park and I'm trying really hard to focus on the leaves. I'm trying really hard to focus on the breeze, but I'm like, shoot, I really have to make that phone call. You know what? Let me just pick up my phone. Let me just open my phone. Oh, and then now I'm scrolling. Oh, now I'm looking at emails, right? So noticing, and that's typical, right? That's okay. We are wired in a way, especially in today's day and age, right? We are addicted to the phone. Listen, right? It's okay, Natalie. Let's get back to our mindfulness. It's okay that we just doom scrolled for 15 minutes. I know it doesn't feel great. I know it feels like we let ourselves down, but let's go back. Let's come back. Let's put the phone away. let's come back to our body.
Okay.
Right. So that's kind of that shift. And I think I think that there's a misconception that in order to practice mindfulness or meditation, you need to be perfect from the start. Like you need to have zero distraction and your mind just can't wander. No, it's almost like it's supposed to happen. And how do you respond to yourself when your mind wanders?
Okay.
Are we responding with judgment? Because typically if we respond with judgment, we're like, shoot, we suck. I suck at this. I'm not doing it anymore.
So there's an element in this about being kind to yourself too, right?
Yeah.
Doing some like positive self-talk
Yeah, that
that,
compassion.
yeah, compassion. Okay. All right. Thank you. All right.
Hmm.
So I took us off the beaten path. So let's
It's
get
okay.
back to the body scan.
Yeah. All right. So and this is just again one brief example. So I'd like to, invite you to find a comfortable position. Typically, right, we would sit with our feet on the ground, uncross your legs. You can put your hands on your lap and feel the sensation of your palms on your thighs. And when you are ready, right, you can take a deep breath in. You can close your eyes, take a deep breath out, and just allow your chest to kind of rise and fall naturally. And I will guide you um, through this body scan. So
Yeah, don't do
just,
this, listeners. If you're driving, don't do this right
yeah, yeah,
now.
yeah.
Come back to this piece, fast forward right now, because we're
Yeah.
going to talk about other things like how did Natalie know this type of practice would work or speak to her, and what happens when she gets activated in session from clients, because as therapists, we do. So fast forward this, come back to this if you need to, or be with us in the moment right now.
Yes, yes. All right. So bring your attention to your breath and just notice the natural rise and fall of your chest. So feel the air moving in through your nose and out through your mouth. If your mind wanders throughout this exercise, it's okay. Just bring it back to your breath. And you can even say to yourself, in through my nose, out through my mouth. All right. I'd like for you to shift your focus to the top of your head. Notice any sensations, any warmth, tingling, an itch. Do you feel your headphones? Is it sitting quite right on your head or over your ear? Right? Just awareness. Don't fix anything. Just aware. Move down to your forehead and eyes. Are they holding tension? If so, try and relax your face, right? Relax your eyebrows, relax that muscle. Now, bring your awareness to your jaw. Notice, is it clenched? If it is, can we allow our jaw to loosen up and relax? Deep breath in, deep breath out. Notice if your tongue is resting on the roof of your mouth. If it is, let it relax. So continue scanning downward to your shoulders. Many of us carry tension here. What do you notice? Do you feel tight? Tightness anywhere? Instead of resisting it, allow it to happen, right? You might actually want to roll your shoulders if that makes it feel a little bit better. But just acknowledge where that tightness is, right? Typically for me, it's like the right side of my trap, of my trapezius muscle. And so we're just noticing. Now shift your focus to your arms, hands, and fingertips. Do you feel warmth, coolness, maybe heaviness. Again, just awareness of that sensation is what we're looking for. And lastly, bring awareness to your chest and back. You can put your hand on your chest and you can just observe the natural rise and fall. And notice any tension in your chest or in your back. A lot of times we carry that anxiety or that emotional discomfort in our chest. So just acknowledging if it feels heavy there. When you're ready, you can open your eyes. And that would be, this is a very abridged, brief example, but that would be, an exercise I would do with the client. I'm wondering how it left you feeling.
Yeah, I think it's really curious that when I think that I'm in a relaxed position, how unrelaxed I really am. You don't realize until you say kind of like drop, drop the shoulders or, like really relax once, well, I forget the exact wording you use, but it's like, oh, I can go another layer, right? I can go
Hmm.
another step further. And, I never realized how much you just hold your body, like even when you're not aware that you're holding your body.
Exactly,
Yeah.
exactly. Yeah, so that's exactly right. We start to notice where we hold tension.
Mm-hmm.
And for me, right, working with a client, that's important for me and for the client to identify where they hold tension,
Mm-hmm.
right? Because as soon as we start to feel the tension, hopefully that could be a red light, right, or a flag for us to say, hey, we need to slow down, right? We need to take a breath. We need to take a minute, right? Whatever it is, because we're
So would this
starting to feel.
would this be considered like part of the mind-body connection that you're using your body to kind of help you understand what's happening with you psychically,
Mhm.
as opposed to the other way around, which we often, I think, come at it from, right?
And I mean, yeah, absolutely. That's the big point, or the big shift, I would say. And actually, I think it goes into your questions, like how did I find myself in this realm?
Mm-hmm.
Because cognitively, right, like there was only so much thinking could do for me. And I think for many people, right? And sometimes thinking about a trigger, a trauma, a relationship is really hard. And sometimes either we can't, we we're almost like afraid of that emotional release. So we just continue to analyze and we continue to talk, right? But nothing really changes, right? So when the client is able to release, have a moment to sit by themselves, it almost becomes an example that they can create, that we can create safety in ourselves and our body, not just in the therapy room, but hopefully, right, anywhere, wherever you are. So, yes, it takes us from the cognitive realm and it really brings us into the somatic and embodied, physiological understanding. Because at the end of the day, if we're thinking of this clinically, we see a lot of this with anxiety, depression, just life transitions in general. It's a stressor, right? When we are met with a stressor, no matter if it's a trauma, right, or a deadline for a paper, it's a stressor. And our body responds because we have this wonderful nervous system that tries to protect us. And we can get more into that.
Yeah,
But
yeah.
yeah.
I mean, I just think it's so interesting because now I'm thinking about all of these techniques, whether it's EMDR, right? Tapping, hypnosis, psychedelics, they're all mindfulness, they're all working to do the same thing in a way, right? Is
Mhm.
to kind of release the stored up trauma so that you can get to a different place, whatever that place may be. The focus might be a little different amongst those techniques, but you're all trying to release,
Right,
relax, get past, move
right.
through. And so, yeah, that does bring me to, I guess, I don't know if this is where you were going, but how this intersects with trauma-informed care,
Yeah.
right? So you talked
Yeah.
about anxiety, and that makes a lot of sense, right?
Right.
And
Right.
now maybe you could kind of shift how this also aligns with your theoretical orientation
Yeah.
within that.
Yeah, absolutely. So it's us meeting today really came at such a timely moment. If you or your listeners are aware of any type of like trauma-informed literature out there, maybe you've heard of the term polyvagal theory.
Hmm.
Just like last week or 2 weeks ago, maybe the drama of polyvagal and these neuroscientists and physiologists kind of came to share some things that came to light. And I was like, oh, wow, this is a lot for me to take in to understand, and then also either maybe adjust my practices or, explain things differently. But I can kind of get into that once I kind of give you the spiel here.
Okay.
But right, so into my theoretical orientation, I think f for me at the base level, like I love to provide skills, right? So again, I'm very much like CBT focused, solution focused. Um, but I also know that emotionally we feel it, right? And something was missing. Like something for me was missing. For my own personal experience, I was on this like hamster wheel. That's what I called it. Of running, 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 running. Wouldn't give myself a break, right? The couch, why do I even have a couch? I don't sit on the couch, right? Like I don't give myself a minute to watch a show.
Uh-huh.
Um, and all I was doing was thinking. And I truly needed something to slow myself down. And just through my own practice and my own therapy, my own, meditation and yoga practice, I really found the sense of calm and like reassurance that I could provide myself was
Uh-huh.
like really like life changing for me.
Uh-huh.
So I believe it's like a really nice add-on to my theoretical approach.
Right. And I think as most things do, they start with ourselves in terms of our practice or why something speaks to us. But how did you stumble upon mindfulness? Like you knew you needed something, right? But
Yeah,
yeah, how did
yeah.
that happen?
I mean, it's funny enough, I was introduced to it in my undergrad through, elective courses that I needed to like graduate. I needed anything, right? I needed a yoga class to finish that one credit, right? So there was a little bit of that. I would say that's more of like the zeitgeist, right? Of like what this wellness trend is. And then it was really in my master's program. I'm in my master's program for counseling. I think like most grad students, was struggling with handling it all, right? Like I was living on my own for the first time. I was a GA. I was working 40 hours a week. I was trying to, succeed in my graduate program. I was thinking about practicum and internship, right? There came a point where I was just like, something needs to give, right? I'm going really fast. And my therapist at the time, she was just like, do you know what mindfulness is? And I was like, rolled my eyes. I was like, yeah, like what? That sounds so stupid. I remember being like, that's a load of BS.
Uh-huh.
And she would just, gently encourage me here and there, drop some hints. And finally, I remember this. I shared an apartment with my two other girlfriends. And I was like, guys, I need to practice mindfulness. My therapist keeps on saying it. So can you guys do it with me? Right. And we put it on YouTube and we did like I forget what it was, but it was like a basic mindfulness. And all of us were like, wow, like we feel so good right now. Like this felt really nice.
Wow.
I mean,
Wow.
I'm lucky that my girlfriends were like willing to engage with
Uh-huh.
me, but
Uh-huh.
yeah, I think that's a little bit of my personal story, but that's kind of what allowed me to, I mean, truly sit on my couch. Like when
Uh-huh.
I tell you I didn't sit on my couch, never sat on it until I gave myself that permission to say, no, it's okay to slow down.
Yeah. So when you have a client who's resistant to the idea or does that kind of eye rolling, do you self-disclose? It's I thought that too.
I mean, yeah, it depends, but yeah, um,
Well, they know now.
well, right, exactly.
No,
But
but
I like to validate, I know it's
why
not for
not?
everyone. I know it's
Sure.
not for everyone, and I get it. I get that this seems super woo-woo and
Right.
silly.
Right.
And I still say, can we try? Can we
Uh-huh.
try something, right? Can we just take a minute to even just to breathe?
Uh-huh.
So yeah.
Uh-huh. Uh-huh. I think those moments are great, those shared moments with clients,
Yeah.
because it makes it humanizes you, right?
Yeah,
And
absolutely.
maybe makes them a little bit more receptive to
Right.
the idea. So I was thinking about how it's tough for us as therapists sometimes to sit with clients in their deep emotional reactions and responses, and we're kind of charged with the idea of holding those feelings for them, giving them that container, that place, right, where
Right.
they can feel safe to express it. And we need to engage in self-care practices. Maybe that is mindfulness, right? But in the moment, when you're in the moment and you're sitting with a client and you're getting that sense of overwhelmness or that sense of sadness or whatever it is, right, that you're
Hmm.
holding for them, are you able to do aspects of mindfulness in the moment, or how do you get through those moments to help you tolerate those experiences?
Right. Yeah, I think it's so, and this is something that I really like to share with my students. Like, we're not robots. We will feel impacted by our clients' experiences and stories. And it's really important for us to catch our own emotional reaction. One, because that tells us something about ourselves
Hmm.
and tells us something that we may need to process in supervision.
Hmm.
So, but for me, yeah, I mean, it's a moment where, and I think maybe you can relate to this, where the client is unpacking something and you start to go this way in your head. And then now you're like, shoot, like I'm now not in therapy with I'm not in my job right now. I'm in my own shit. I'm stewing in my shit. Sorry. Right. And I think it's again, it's for me, the practice of being like, let's take, as I'm here, let's take a deep breath, right? No one needs to know. Take a deep breath, allow myself to breathe and say, let's focus back on what Amy is saying, right?
See, that's so interesting. Because I'm a psychodynamic psychotherapist. And for me, there's information in where I got distracted, not only about myself, right, and my reaction to them, but is there also a transference in that? Am I responding to the real them and how other people might be experiencing them? Or can it tell me about what they're experiencing? But so I'm using it, and to me, it's very important to use it. You're
Mm-hmm.
talking about being able to ground yourself to come back and be present for them. But I don't see it as like such a, I don't know if you're saying negative, but whatever, like I need to come back to them because I'm still with them, even though I'm away
Hmm.
from them. Because does that
Yeah.
make sense? I'm
Yeah,
learning
no,
like what just happened here.
absolutely. And I think, absolutely, I think there's so much to that when we are able to say, that's really, that's really sad, or, or I'm feeling an emotional response as you're sharing that, right? I think that's a powerful intervention in the counseling room. Where I find where this non-judgment awareness of the present moment is helpful is when maybe we fear we can't bring ourselves back to the client,
Mm-hmm.
fully. We
Mm-hmm.
can't,
Mm-hmm. That
where we
makes
get
sense.
so lost in the
Yes.
sauce with them that we then don't even know. Like
Yes.
now we feel like we're floundering a little
Yes.
bit. So
Yes.
it's a tool for that more so than than anything else as an intervention for a client.
That makes a
But
lot of
also for,
sense. That's
yeah.
great. Okay. Um, have you found that there are misconceptions about mindfulness?
Yeah. There's a misconception that mindfulness comes easy.
Hmm.
Mindfulness is this easy woo-woo hippy-dippy thing that, makes me happier.
Uh-huh.
And in reality, it's the opposite. It's hard. It's difficult. It's a practice. I always say to my clients and to my students, it's a skill. It's a muscle. We have to do more of it in order for it to really feel impactful and embodied. And it's also, especially with meditation, allowing your mind to just wander and see what comes up can bring up some really hard things.
Well, it requires letting go also, right? Not being in control of what
Right.
happens. And I wonder,
Right.
Yeah, interesting.
Right. So that I think, no, mindfulness is really hard, right? It's really hard to sit with what's coming up. Maybe it's that negative narrative you have of yourself and it's awful. And now we're asking you to sit with it and listen to it. That sounds like that's impossible, right? So it's hard. It's hard. And I think it's actually really like gritty work sometimes to be like, this is what's going on in my head. And because of it, I feel so anxious. I feel depressed, right? I'm in this negative headspace. But if I can bring myself back with compassion and say that is really hard,
Yeah,
that was very traumatic,
yeah.
and I'm going to regulate myself. I'm not going to try and analyze it. I'm not going to try and come up with a response in my head to that person. I am just going to let the sensations come and actively slow my nervous system down.
But see, when it's when you explain what it is that I can understand it being a little um, hard to grasp, fearful, right? Because you're not in control of what's going to come up. Stereotypes about the woo-woo-ness of it, but maybe the woo-woo-ness of it is the fact that people don't understand what it is, right? And
Right.
it's not really explained well.
Right.
Um, it's curious. I wonder, I mean, I don't know what the conversion rate is, so to speak, of
Right.
those people who are doubtful, skeptical, and then, do buy
Right.
in.
Well, I have to say, for the listeners or for you, I mean, John Kabat-Zinn's book, Full Catastrophe Living, um, is remarkable. I mean, he created the mindfulness-based stress reduction clinic, but the book is great because it kind of brings you it's very conversational and he shares with you the pushback that he's gotten from his patients and the change that has happened over time. And I think for me, really being able to provide that psychoeducation to my clients about what is happening within your body,
Hmm.
right? I think that also allows them to see that this is rooted in evidence,
Hmm.
right? There's a lot of evidence, especially with trauma and stress, right? When we are faced with a trauma or with a stressor, our nervous system, right? Fight or flight freeze happens,
Hmm.
right? So what mindfulness does is like it's like the antidote, right? The fight or flight and freeze are ramping up. We're activated, and mindfulness is like the brakes. It allows our body to come to a place of regulation. And this is where the debate of this whole polyvagal theory comes in. And it's more so about the semantics of like the literally like the brain cell
Right,
or the brain stem, I'm sorry,
right, right.
than anything else. And there is merit to that critique. But it doesn't take away the fact that yes, like we need safety, we need co-regulation in order to work through our dysregulated nervous system. So I like to provide that very like understandable, really approachable background.
But no, I think you've been successful in doing that. So I think that the last piece that I think would be really, really helpful is
Mhm.
if you could provide an example of a time in your practice where mindfulness like really shifted the outcome, where there was a tangible
Mhm.
outcome you could see.
Yeah, for a client.
Yeah.
Yeah. She's one of my clients I still see today. She was one that is open to mindfulness, but like, everyone else, it's something that's like aspirational, right? So there was this one session, I'll say probably back when we first started, maybe like 2 years ago, and she was crying, right? Like really, really just processing something really difficult. And she was very emotional, right? And what I said to you earlier is what we did, right? Hey, this is really hard. Can we just let's take a couple of deep breaths. Let's give ourselves that safety. Let's give yourself that safety. Um, and by doing that, I think really show because her history involves her really not being protected and not being safe growing up. I think by her seeing that she can get herself to a place of regulation, of calm,
Mm-hmm.
was really impactful for her. Like she
Hmm.
was like, "Oh, I I can do that. Like myself, I can do this myself. Wow." And not to say she's like, a Buddhist now, but like, right, it has been a really powerful tool that we come back to in session, or that she says, "You know what, Natalie, I've really tried to integrate mindfulness or meditation at least like once a week out to the session." That's amazing. I love that, right? But it's that I think it's like that what do we call it? Corrective emotional experience,
Yeah. Yeah,
right?
well, I'm also thinking about soothing. If you've never been soothed, how do you learn how to self-soothe? So, and that causes such emotional dysregulation. And so to give somebody a tool where, and again, I can't help but making the analogy to what I do, right? The idea is that hopefully a client can internalize my voice, the soothing just reassurance or validation or whatever it might be that I offer them just through natural interpersonal relationship, but they don't
Right,
have that kind voice themselves. So, over time, takes a lot of time. They internalize that and it becomes their own. That's the hope, right? And
right,
one day you won't need me to do that for you. And so I think
right,
about the role that this plays in that very similar way is that you're giving them a very concrete tool that they can use, and they need you and your guidance to provide that, I'm sure, more than once for a while. And then to be able to, wow, what a moment. I mean, I could feel that when you said it, like to be able to say, wow, I can actually, hold myself. I can put a warm blanket around myself and feel okay. I don't have to call five friends and try and find the one that's actually gonna mirror me or, say what
right,
I need. Yeah,
right.
that's fantastic.
Yeah. Or I'll even say too, in a different way in which this has been really impactful for my clients is for some clients who really avoid emotion, right? And it's almost like these little pockets of like where I'm like, oof, like we're gonna poke the bear here. And where they're bringing up something stressful, frustrating, sad, anxiety producing, self-shame, you name it. If I'm finding a hint of that underlying what they're talking about, I just say, can we just stop right here? And can we just sit with what you just said about yourself?
Mm.
Right.
Mm.
And typically, right, the person who pushes that emotion away, that wants to analyze, that wants to think it through, the emotion, like the catharsis that comes from being like, oh wow, yeah, that was really intense or that was really harsh. And now let's sit with it.
I was just thinking that because you took a pause to sit with that, to help them sit with it, to be
Hmm.
able to experience it, tolerate it. It makes me think when you say you don't have time for your couch, why do you have one? Because going, 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 we don't take the time to just be, to ever
Yeah.
just be. And some of us do that intentionally, right? Because you're scared with what you're going to be left with, right?
Yeah. And so when
But,
I call it out, they're
right,
like, oh no,
right.
Natalie.
Wow. Yeah, that's
So,
powerful. I'll tell
yeah.
you, this honestly has made me think like, oh, I want to try this.
Yeah.
I want to try this in my practice. I need to read about it a little bit more, get more familiar with it, because I think that it sounds very easy to just like, oh, I'll take somebody through a body scan or I'll, you know, ask them to get in touch with their five senses. But you got to know a little bit more about what to
Yeah.
do with it, how to read what they're saying, how to be with them in the moment. And I think something I've taken away from it is it's not as simple as it sounds in a way. It's not as simple as it sounds in the sense that, let me think of how I want to word that. I don't know. I think it's kind of like been disregarded as you're
Yeah.
saying, an evidence-based practice or as like this woo-woo thing. So it doesn't have like stature connected to
Hmm.
it. And on the other
Totally.
hand, it's simple enough that one can integrate this into their daily life or however you practice therapy or working with other people. And so it's manageable and
Yeah.
it's workable and it sounds like it has the potential to be so impactful.
Right.
So why not,
Yeah.
give it a try?
And I have to say, right, the idea that we need, and this, I mean this with, you know, with context, I guess. The idea that we need all of these resources and tools to help us become quote unquote normal really discredits the fact that we as humans, like our bodies, if we just listen to ourselves, right? We can provide ourselves that safety. Obviously, right, medication is needed and right, coping skills are needed, but the idea that you yourself can heal or you yourself can provide yourself with safety, I think we've kind of lost that authority that we have over ourselves. We
Oh,
don't
wow.
realize that about ourselves.
Right. And maybe that's the piece about simplicity that I want to clarify is that it sounds like this is something anybody can learn, even though, as you said, it might not come naturally. And so don't get frustrated with it, right? But if you keep at it, soon enough, it sounds like soon enough, you can get the hang of it.
Yeah,
And it
yeah,
can have such a positive
yeah,
outcome
yeah,
rather quickly.
yeah,
So I buy in, and I mean that for real. Like I
yeah.
really feel like you made this tangible, manageable.
Oh,
Like
good,
it's concretized, it's digestible,
good.
and I want to try it on.
Yeah,
And I guess
absolutely.
I got to try it on myself too. I should say before I
Yes.
read about it and try it with my clients. I'm gonna try it on myself as well.
That would be the one thing I would share with any therapist if you're gonna if you would like to integrate this into your practice, really try to do it yourself,
Hmm.
right? It will come across just like with anything in therapy, right? The genuineness, it'll
Hmm.
come across when you know how hard it is, when you know
Hmm.
that your mind, when you know how judgmental you are to yourself, right? We have to kind of live it first in a way. So yeah, I would suggest, embodying it yourself.
Uh-huh.
And listen, I'm not perfect. I don't practice it every single day, right? And I have a newborn now. So but I find myself like, oh, I really need to come back into my body. Right? So,
Wait. What happened to the judgment? No judgment.
right. No judgment.
So
No
what? You don't do it
judgment.
every day. Who says you have to do it every day? What do we do every
Right.
day?
Right. So,
Anyway, Natalie, soon to be Dr. Nieves.
yes, yes.
Where do you want to drive people towards your website? Do you want people to come to you and practice mindfulness? You want to give a shout out about anything?
Absolutely. I mean, if you are interested in working with me, you can find my information on Psychology Today or through Headway. You can find my information and check up my availability. And I love to continue working and hopefully providing the right type of support that people need. So
Okay. You
yeah,
said it. That's it. Natalie Nieves, Nieves.
yeah.
Thank you so much. This was
Thank you,
great.
Amy. Thank you.
Thanks for listening. I really do appreciate it. If you like what you heard, please consider leaving a rating and review on your podcast platform. And don't forget to subscribe so you don't miss my next episode. If you're struggling with clients, I'm happy to consult or provide supervision. Consultations are also available for any person listening. If you're struggling with sibling abuse, you may want to join my sibling abuse workshops. I'm open to feedback on topics you'd like to hear or questions, so feel free to email me at drmeyerspod@gmail.com. You may be interested as well in checking out my blogs on my website at amymyersphd.org.
I've got some problems, yeah, I've got some questions. I need some help, point me in any direction. Clinical guidance is what I need to help me become who I'm meant to be. I've been searching for a teacher, another point of view. And I've been asking myself, what would Dr. Meyers do?